Thanks for staying with us. So earlier we're talking about distraction with the phone when young people are not passing their examinations. And a similar story came on social media where we had a nurse who was supposed to be caring for a woman, a pregnant woman in pain. She was obviously in labor. And it seems as though the nurse was taking a selfie and posted on social media. Now, there are various comments on this. People are saying that she could not be a real nurse. A real nurse wouldn't do that. Others are saying it is very unfair for her to do that. What are your thoughts, especially because in this new age of social media, everything is content. Everything is, and content, they say, is king. Content is what we want to see. Content is how you make numbers on your social media pages, and that's how you get revenue. Content is how you feed. Content is how you also impact the world. So in this new world, she saw an opportunity for content and she took it. What are your thoughts? 081-764-1679, 090-24163440. You can also tweet to us at TVC. Can I please hashtag YourviewTVC so we can retweet? Hopefully we can get an opportunity to show the video for a second. But what are your thoughts? Content. Everybody's looking for content. And this nurse, hopefully, I don't know if she's a real nurse, but some are suggesting she might not be a real nurse. But even if she is, what are your thoughts?
Even if she's not a real nurse, is she a real human being? Because she was standing over a woman who was obviously distressed and in labor, and she thought it was a time to be taking a video and smiling about it. It's really a sad situation. And you know what? Every time we're constantly talking about going for trainings to improve ourselves with really hard skills, we obviously need some soft skills. I mean, as a human being, forget the uniform that she's wearing. You're standing over someone who's distressed. That is not the time to be taking that sort of content. If the content is not the sort of content that you're trying to look for more help for her, or you're trying to figure out how to give her better help, then you shouldn't be taking it at all. We've seen people do these selfies at funerals. You see people taking this over a body who has, that's been declared or about to be declared, dead, and you're taking selfies. The family is not even aware that their family member has gone, but because of your content taking, you have put it on. We don't understand that there are some things that are so important and sensitive. And my grandma used to say, there are things that we used to do, she'll be so disgusted and embarrassed for us. Like, people will say you don't have home training. There's to be a time that when they said that to you, you'll be ashamed of yourself. Like to say you don't have home training, because at home, there are things that you are taught that we recognize. You may not learn it in school, but you will learn it at home. Empathy, understanding sensitivity, just emotional intelligence. Where is it? Who is it? And then forgetting that, then who is consuming this sort of content? When we see videos like that, what do? I hope that that lady is properly dealt with. Yeah. I'm not saying she should lose her job, but she should.
She's young. I mean, mistake.
No, you know what? I think she's
that's not a mistake.
But she should go through a form of
disciplinary action.
Yes, disciplinary action and rehabilitation. She should wear those my orange suits I like people to wear. And then go and sweep somewhere. And then go from one school to the other and teach them the things not to do with social media.
But Nima Ramatu, I mean, the reason why I said she's young, because young people, youthful exuberance, you do this kind of stuff, you think you're a nurse now, you have this opportunity, hey, let me take the content. Maybe she shouldn't be, her license shouldn't be withdrawn. I mean, I think that shouldn't be the... What are your thoughts?
In the hospital, I think he's totally wrong, honestly, because that woman is in pain. And you, Gen Z, I'm sure...
But there's nothing she could have done to reduce that pain.
But
selfie or not, you will still go through your labor pain.
Okay.
So it's not that there's nothing I can do. So I'm taking a selfie because I realize that, okay, you're in pain. Hey, sorry, but hey, it's going to happen.
But there are so many things she could do. She could be rubbing the lady's back, or be pecking her, yes, or be rubbing her feet or something. She has to do something. She's a nurse. She's a caregiver. So she's supposed to show care, show love. I remember when I went to, when I was going to have my son, when I went to the hospital, the nurse, immediately she saw me, of course, is this your first child? No, my third child. And she was like, he's not yet ready for me to have my child. She was busy taking her selfie and all. Already, I just set her up. I was just looking at her. Well, I finished taking your selfie. When it was now time for her to check if I've dilated, if you see her nail, Jesus nail.
Yeah, a nurse.
Long nail. And she went to check if I had dilated. And I was like, with which nail, with which hand, which finger do you want to use? And she was like, madam, you're not ready. I was like, no, you can't do that.
Can you imagine that? She was ready to
She was ready to check me with that long nail.
Ew.
And then
So you know we
phone-
have a problem.
And as she was doing that, once her phone rings, she would just pick it up, go out, say, excuse me, I was
And
in
phone is like
labor,
the
in
most
pain,
dirtiest thing you can
in
hold.
pain. And then she came and she was like, you're a Hausa woman. I was like, the Hausa women don't shout when they are in labor. I was like, you've met a different Hausa woman. I'm going to deal with you today. So this Gen Z thing, this new,
young
this
nurse.
nurses, yeah,
Was a young-
she was very young.
So too many things wrong with this video. Too many things.
Too many.
And one
This
is
story.
that, you know, you didn't get the permission of your co-participant in your video. You shouldn't have. Invading her privacy, her personal space, while she's in pain, in her vulnerability. You have put a camera to her face, and it's a popular thing that they call it skits. You know, we see these contents where people enjoy it. Somebody will just come and set up some kind of how do I put it? I don't want to say irritating, but embarrassing situation, and then put a camera to somebody's face unprepared. Make a content of it. Put the person's face on all social media platforms while he's making money on that content. That person is being embarrassed nationally. I see some people do it with English speaking, and they put camera to some people's face. They go to some, suburban universities, interior universities, and put a camera to somebody's face as if English is the test of intelligence. Showing that you yourself, you lack intelligence. You put the camera, you ask the person a question, the person is graduating, and the person wasn't prepared. Your intention is not to teach the person, it's to further embarrass the person. The person just has 3 million views on somebody else's account.
So, but
and you run along with it. Now, you're in your professional capacity. You need not face your work. Because in that position, I don't even want you to have empathy alone. Be professional. What would you do?
But do you realize, Nima, that the woman in labor can be appreciative of that video, that somebody caught me? Because in this new world we are in now, people are looking for content, that natural content that shows me when I was in labor. My family wasn't around, nobody was around. You're the only person, and the nurse took a video of me in labor. Can you see me? So sometimes, wait now, I'm just telling you that the reason why a young person will take an advantage of an opportunity, you see content, you record it because you feel that this person might even need this content. I remember that when I share how I looked on my sick bed, when I had the accident, when my brothers and sisters, my brother and my sister-in-law described what they saw, I only had one wish, that they took a picture. Because I could only refer to what their stories were. Say your leg was tied up, or your face was bandaged, your lips were swollen, your eyes were bulged out, the machine was hooked up to your body, and I was all bandaged up. Now, they didn't think at the time, this was years ago.
You know why?
They didn't think because they're all traumatized, obviously.
But you know why?
Because the social media was, if it was social, no, Mariam.
Okay, finish.
Social media was in there. At that time, there's a possibility that they were taking a picture.
You're talking of family.
There's a possibility.
No. So, are you done? When people that love you, when they see you in some situations, the last thing on their mind is to be taking a picture of what you look. In fact, that's what they want to never see again about you. That is something that they hope that they would never have to see about you ever again. That's people that love you. When a person comes into the state where you are most vulnerable and wants to document it without your permission and put it up on social media without your consent, there's no love there. It's to embarrass you, it's to make you feel small, it's to empower them for whatever reason, for them to take advantage, it's taking advantage. That's different. Before social media, my second child, my husband was in there and he took some videos and some pictures. I remember one of my aunts was saying, she was like, don't show me. I can't believe you went through this pain. Do you understand? That's what when people love you, they don't want to see you going through that thing over and over again. I understand you may be curious, but understand those people that did not take it because they loved you. So let's just say you've come out of it, or even before you finish coming out of it, mentally you're trying to get yourself. You find out that there was a nurse that actually took a selfie of you in that state. How would you feel, Mariah? Tell the truth.
I will take the picture and I'll keep it. I have evidence of what I went through.
Okay.
But it's looking at it in different ways. I will take the picture. And today, I'll have a picture to show you that this is what happened to me. See how God saved my life and where I am. So I'll have that evidence. The point I'm trying to make is that in 2024, taking a picture or recording a situation is usually content. Now, maybe not for posting for your personal use, but just to let you know that, see, this is what when you're screaming in bed, you'll see what you look like. So at that moment, now somebody who probably cares for you will forward it to you.
Can we talk about what it takes to do those kind of videos? So you're in pain, and I want to do a video of you. I want to keep it just in case you might need it, my camera lens will be in front. Not with me trying to wave my hand.
Thank you. I'm not in it.
I'm using you without your consent. You have not enlisted for this video. We did not discuss it. I did not tell you that this
that you wanted.
And I will do like this.
Of course.
I'll do like this again. I'll use a selfie angle. That is actionable. There's no even, don't sweat it. Just call me. Let us help you to sue. You know, don't sweat it at all. You can't put a camera before loved ones. I took pictures of my late father when he passed. Because I know, aside the family, people will question, what happened? Who was there and what? But I didn't send it to any of my relatives. The moment I sat down and rationalized and said, whatever they want to do, if they are not satisfied with what I have said, they should do whatever they like. I deleted every single picture. Do you understand? You don't want to, that's not the memory of my loved one I want to keep. The memory of my loved one I want to keep are the beautiful times.
I have some very private pictures of my mom and last conversation we had that not a human being on this earth has seen. And I kept it to myself.
Yes.
And I don't plan to share that to anybody. Nobody needs to see it. I'm not sure my husband has seen it.
So imagine that I hack your phone. So imagine that I hack your phone now for trending. I said I help Mariam now. And now put it on my TikTok 10 million views page. Everybody now start to have comments. Because people don't share your sentiment about the things you love.
Yes.
If you share, once you put it out there, it's what I think, what Rama thinks, what Mariam thinks, and it can be anything. It can be the most damaging, the most destructive thing, and we'll be putting it with no sense. We're saying we are being vocal, we are being kinikon, we put all of that. You don't want that.
I want to say something maybe in agreement with what you have said about people wanting pictures. So as I mentioned not too long ago, my friend lost her mom, and she was involved in taking, the final rites of getting her prepared. And she says her brother called her to say, did you take pictures? She was like, pictures? I didn't even think of pictures. I was prepared. But she had a friend who was there and was taking some pictures.
Yes.
Well, also, while that friend was taking those pictures, there was another sister who thought, Auntie, not this point, maybe another. Do you understand? So, yes, the people who love you, they first will not be let them take pictures. But the person who's also taking pictures has to be someone you trust, that person is handing over those pictures to you. And also there are ways pictures are taken that it's about you, and it's done in a decent manner. And there are ways that pictures and videos are taken, and it's about content, it's about themselves. So if someone does not care for you and care for what you're going through, they will take this story in such a way, they will sensationalize it in such a way that, it makes you look bad. And for me, for the sake of no problems at all, do not take pictures of anyone unless they open their mouth and say, take the picture. And then you are not the front and center of that video or picture. That person is, and you hand it over and be discreet about it. That's
how I come to you, Ramatu. Funto, thanks for calling. You're live. Hello, Funto, you're live. Go ahead, please.
Good morning.
Morning.
Well, I'm so sorry. I want to speak to you.
Go ahead.
The point is that one can. Okay, thank you.
You listen to the TV. Listen to me, please. Go ahead.
The point is that I can't hear what you are saying, but at the same time, I have the opportunity to speak to you. And that is why I'm speaking now.
Okay.
Now that you are listening to me, it's no point.
She's listening to it. You have to cut it off.
There's no point that one should speak louder.
You listen to the TV, so it's delayed. There's a point that Mariam made earlier, and I'd like to go back to. Like the ethics of taking a picture of remember somebody died, maybe they drowned. And you're already recording what happened and posting it even before the family is aware. Exactly. The ethics of this. We're going to break when we come back, because this modern times of people just taking pictures, taking the liberty to record and the most private or distressful situations of people who their loved ones rather have it private. When we come back, we'll discuss that. Stay with us. We'll be right back. Thanks for staying with us. So new times, new rules, new behavior. People are taking pictures, videos, everybody's looking for content. And I was saying before the break that, there was an accident that happened, and people were taking videos of dead bodies, even before the family even knew that was their loved one that was there. And these are some of the things that we don't consider before taking these pictures and posting on social media, because in their own mind, for a young person, I'm just trying to let the world know what happened. And we don't want anybody to change the news or maneuver or manipulate the news. I'm trying to tell you what happened. You know, it happened on NSAS to tell us exactly what happened, show us the evidence as it's happening. As people are dying, record it and show and post. We were grateful for all the NSAS pictures we saw because it happened. But if a loved one was amongst those who were killed, you're now wondering, okay, would I have liked that? So is the ethics of how do we maneuver? How do we? Where's the line we can draw between providing information real time and also protecting people's privacy? It's been blurred.
Amos, you want to go?
Well, I think we should protect people's privacies, honestly, because I can remember Mohbad's death. They took a picture of him. Up till today, anytime I think of that picture, I still feel somehow because he was in his coffin and his neck was bent. He was like the coffin wasn't done for him. He was bent and all. Up till today, I still feel. Anytime I remember that death, I still feel pains in me and all. So I think there should be privacy in, taking pictures of the dead. I think there should be privacy in that.
So professionally, what I learned one time when I had lost a baby was that, they do pictures. So I was in the process of evacuating the baby and all sedated, partly conscious and unconscious. I just heard my husband saying to one of the nurses, drop your phone. How do you have your phone? How did you get your phone in theater and everything? And so when I became conscious, I waited for that story. He didn't drop it. After about 5 days, I asked him what happened about a phone in the theater. I said, one of the nurses had a phone and he thought she was making a video, but he doesn't think anything of it. I just pretended like it was normal. I said, I need to go to the hospital for a check. And he took me. He didn't expect. I waited for him to go to the car. I went to there. I said, look me in the eye. Very well. You're in trouble. We'll kill ourselves. I see my picture, my baby's picture, anything. And she had to apologize. They said it was part of a hospital routine to do that video. But nobody had informed me throughout my stay in the hospital of such an incident, such an eventuality. In case any of this happens, we might need
evidence, just in case something happens.
And it should be exclusively my prerogative whether you want to do my video or not. And if you do have my video, the entire content is mine.
Yes.
It shouldn't be at any point, because I had to call a friend abroad and she was like, even in their own hospital, such babies are even waxed. They will put their hand on their feet as a gift for the mother. Sometimes they will need mittens and, socks for the mother. So you have those things, they will frame them. You can keep them as memories. All geared towards the patient to help you heal. That measures like that, to encourage your healing. Maybe when you come out, because in Islam, I believe that my baby did not die. My baby is waiting for me in the hereafter. And, maybe I want to keep such a memory item. But everything is focused on me. But, the way we are quick these days, kicking. If you're kicking me in such a vulnerable
Let me take this call from
it's actionable.
Kelvinson from Delta. Good morning, Kelvinson. Kelvinson, you're live.
Yeah, hello. Good morning.
Kelvinson.
Can you hear me?
Yeah. Very clearly. Go ahead, please.
Okay, I'm watching your program right here from my television.
Okay.
I really enjoy the topic you just... Okay. Yeah, I enjoy your program this morning. Yeah, the topic you brought up now.
Don't listen to the TV, listen to me. Go ahead, you are live. We can hear you.
Okay. In terms of content creator, many people take laws into their hands by using someone predicament. By using someone predicament as a content without consult.
We have to disconnect the call. Please, when you call a live show, just speak to me. What you hear on television is delayed. So if you're listening to the TV, you're going to be messing up the communication. But yeah, you're going to come.
Yes, okay. You were saying, how do you separate when it's for, when it's done right, for evidence, and then when it's, so context is very important. And that's why we talk about emotional intelligence. But I'm now realizing that for some of the things that when we were growing up, we understood as common sense is not common anymore. That's one thing I used to hate, but now I think we have to bring that saying back, that common sense is not common. And so we need to start teaching people about common sense. If you don't teach that sense, it is not common. In a war situation, you're taking pictures and videos, you're bombing your houses, soldiers, armed robbers have come. That's a whole different context. And a human being, an adult human being, even a child understands that that's a different context than a nurse or a doctor or someone or a professional that is supposed to be helping you and decides to use the opportunity to film themselves flicking their hair, Snapchatting it as they go. Do you understand? There's a difference when you're taking evidence. If you're in a war situation, I'm sure she will not be in that flicking her hair and whatever. You'll be so afraid. Right. But when you are in a situation like, you know, the one that we're discussing now, and it's really about empathy about that person, you would face the camera to them and you would give them that evidence. It's even, I had a surgery also some time ago, and I remember the things that they were giving me. It included the video of the whole procedure. I remember the Oyinbo doctor was like, oh, we took out this thing from your stomach. It was such the most beautiful color. I said, Oli Oyinbo. I reject it in Jesus' name. It's out of my body, you know. So, but, you know, it was handed over to me. It was not, and of course I signed a form, you know. I knew that that was going to happen. And it was supposed, for me, like for you, to remember what it is that I went through. I never watched it because for me, it was done, you know, and dusted. So we understand, human beings, adult human beings understand context. They understand that there are some things that are sacred, they are vulnerable, they should be respected. And there are some things that is for evidence. I'm finding that many Nigerians do not understand that. We have talked about, you know, where our elders went for a particular funeral and were throwing jabs at each other. We're talking about people in their 60s throwing jabs at each other at a funeral. Common sense is not common anymore. We're doing so many things. So when our younger ones, our children and their friends are doing things, you know, it's hard for us to talk because we have done bad things. So now we have to sit down and have a school of common sense, a school of empathy, a school of respect, so that we can learn how to behave better.
Macy from Rivers, thanks for calling. You live.
Good morning.
Morning.
Watching from this video that they just showed, what that nurse was doing was so heartbreaking because she would have done something to help that young woman. Now, there are some cases that you see that a pregnant woman, before you know, from 1% after checking the CM of a pregnant woman, before you know, within few minutes, because some person's body, they open differently.
Yes.
You won't even imagine that from just that bit that this woman is making this video, the woman has gone up from 1% to straight up to 9%. Now, this woman in question making this video, she's doing it without the consent of this woman. From this video, so much in pain. Now, I could remember when I had my first, I was in labor for almost 4 days. I had my first child. When I was in labor, they had to tell me to walk up the stairs of the clinic. When I got up to the stairs of it, one of the nurses there she was telling me that when I was enjoying when I was enjoying myself with my husband, I didn't feel this kind of pain. Now you don't reach now. Some kind of statements that are heartbreaking.
Thank you for reminding us.
Thank you so much.
Before being a nurse, you are a human first.
Thank you.
Before you become anything, that you are a human first. I don't know what.
Thank you very much, Mercy. It goes back to youthful exuberance. And I think with something, listen, it goes back to
what she reminded us of.
Youthful exuberance, because young people make a lot of errors.
Yes, that's
what I'm seeing is in my own head. A young girl just graduated from school. She's now got a job in the hospital. It's her first job. It's her very first time she's taking care of a pregnant woman. She's excited. You know, she feels like, listen, her mom is going to be happy and proud of her that she's the one caring for a whole nursing mother. I mean, the mother was about to have a child. So she's taking a selfie, just evidence. Like my very first one, she even had the BP machine thingy on her hand. And she was, so it's possible she just had that excitement. Like, listen, I just took her BP. She's in labor. I'm the one thing I've been assigned to her. I'm just taking evidence of payment. So it's part of that young feel of, listen, it's our world. Everything in our world is documented. We record it, we take a selfie, we post it, we keep it as evidence of the work we've done. It's the new world we live in. You might not understand it because in your world, you didn't have those. But in their world, it's normal.
So nursing is a very professional, very detailed profession. The training is so detailed that
maybe they stop training them.
They don't finish training. No. When they finish that, they have 3 years.
Yes, I have stories.
So for those who even do the 3 years or those who do the degree in nursing, I think degree in nursing lasts is 5 years.
Yes.
So when they finish, they are already they come with experience because you spend your entire training in hospital. You cannot now say you have useful, you are non-professional. You have disgraced the profession.
Exactly.
If you have a BP machine in your hand, a patient in labor by your side, and you have a chance to use the last hand to open, something is wrong with you upstairs. It is not useful exuberance. It is unprofessionalism. It is immaturity. It is lack of empathy. You are not human. Okay. It must be something else. Okay. You even have time to have makeup on point.
She's a nurse. She's not an old lady.
Now, we need to talk about the olden days nurse. The last caller brought us. Those ones who we ask you, when you were doing one leg up, as if you saw.
No, that is so disrespectful. And that one is not youthful exuberance. That was Nigerianism. Our Nigerian attitude where you just open your mouth and just speak to people. That was wrong. But I'm going to say something in your defense. Mommy, I'm going to give this story. Please don't be angry with me. Youthful exuberance happens. Yeah. Young people make mistakes. My mom told me of a mistake she made as a young nurse. So sorry. She said that she had been overseeing a patient. She was I think she was still in nursing school. So you get to work in the ward sometimes. And the person she was overseeing passed on the night before. First thing in the morning, the wife comes in and asks, where is... And she goes, oh. Person asked, but the woman grabbed her. Neck. Yes. Because there's a protocol. Yeah, but she did not understand. She was quite young and she thought she was doing the right thing. So that happens. Yeah. So that's the only reason why I say for this girl, maybe she should not lose her job, but she should go through some disciplinary action. Yeah. You know, I always say that we should give young people grace. Yeah. But also, it makes me question the schools of nursing and what they are teaching them. As I said, you get the documentation, the certificate, for the hard skills. We need to start talking about the soft skills. So nurses, you're saying that the younger nurses don't understand many things. They don't understand. I would go to the hospital. I tell my mom, I would go to the hospital. If I met a young nurse, she will remove, and I'm supposed to take an injection, she will take it, pia, pia, pia. But an older nurse will explain to me, you're about to take this injection, show you the bottle. I'm supposed to give you something meals of it, explain to you and show you, and I'm about to give it to you. My mom would say to me that when you go to the hospital and a nurse doesn't say ask them, you know, because it's required that they do that. So there's a lot that we had, the good things that we had, we're not passing it on to the next generation. We need to do that.
So that's why I'm saying let's not use the sledgehammer.
Yeah, I get that. That's the only reason.
These does not look like, she doesn't look like someone that...
It's not about looking at her. It's not about mistake. So she's actually taking 5 seconds video cannot give you that information. Let's not assume that, this one is not, because the truth is that she could be and she may not be. But what I see, we are all seeing things from different lenses, and that's understandable. But I just see a young girl excited. I can see joy. She's happy. She doesn't look like a frustrated Nigerian nurse. Many Nigerian nurses are frustrated. They hate their job. This girl looks happy, proud of what she's doing. She looks like she's excited of this new profession. So this is a proud Nigerian nurse. Unfortunately, maybe she was just being overzealous and in the excitement and just wanted to capture the moment. I'm just trying to make us understand that this new world, we that think in a different world, how do we marry our own common sense to what is sensible to a young person today? For her, it doesn't make it, I'm just recording you. Hey, I'm going to send it to you. And maybe it's even her, maybe she eventually got permission from the lady in labor to post it. But the point is that I've recorded it. For you, she's doing you a favor. She's recording you in labor. That's content your husband doesn't have. That's content your family doesn't have. I'm getting you content. I'm going to send it to you.
Silly.
So in the world they're living in right now, it's all about content.
Dramatic, you want to go? Because I have one example of how to marry it. So, as you know, I do book reading in schools. And from the get-go, I knew personally, my sense, thank you, Mommy, for raising me well, that I would go to the schools. I would never take pictures. If you look at the videos, you would always see the children from the back. If you see their faces, I was given express permission to take their faces. I would send those videos before I post them on my social media to the school to, you know, to vet it, to approve whether I should put it on social media or not. I did not need anyone to tell me because I understood that this is private. Because also, personally, also, if you look at, you would never see a picture of my children in their school uniform on my social media. The only time you would have seen my child in school uniform was my son when he was graduating from that school, not in that school anymore. There's just some things I feel is just common sense, you know? Yes, we understand that if people now will give you consent, like the woman in labor giving a nurse consent. That's weird to me. I would never give anybody that sort of consent. But we now understand that people can do that. Mariah would not have minded if a random nurse had taken a picture of her in that vulnerable state. If I was your relative and I was there and a nurse tried it, as you know me, I will break quite delicately that nurse into tiny pieces.
Let me take that for Let me take the call. Excuse me for broadcast. You're live. Thanks for calling.
Good morning.
Good morning, sir. Go ahead, please.
Yeah. Right. So I want to say something. That this is something.
I can't hear you. The line is breaking. We got a lot of calls from River State today. Almost all our calls are from Port Harcourt today. Let's take a few comments on social media on this.
We have the kids on Twitter. She's saying your loved ones would not want you to document your pain. If they do, it wouldn't be in the public. It won't be for public consumption. But we have plenty of people on YouTube.
Okay, so let me...
You know, these days, some children have started going into that profession for the pride in it and not for the care and compassion, which should be the first qualification in the profession. Go on, Mariam.
Okay, so there Hafsa, she said even the soft skill is part of the training, Mariam. Where do you think the older ones learn it from? They are just being Gen Z.
I'm thinking that they're not teaching them the soft skills. Is what I'm feeling.
I think I'm also guilty. I think I've shared with you guys privately. There was a time I told my husband about somebody who I thought had died. Somebody my husband loves, an international artist. He loves this person to pieces. And I thought the person had died because I got news about the person dead.
Yes,
and I told my husband the person, and he burst out in a lot of emotions. And I was recording. I said, I cannot lose this content. I must record. Because my husband was literally getting so emotional. He was just going on, and he was very crying. I was like, this is, for me, as a 2024 adult.
And a media person.
I cannot lose this content. Yeah. You don't get men crying very easy. I had to press record. He said, why are you crying? I can't write. Do you know how important it is? Till tomorrow, he doesn't know that I have this video.
Now he knows.
Because God forbid, no, he's not going to watch TV. Maybe that person eventually, I can just post it to him and say, listen, I have this video. But I kept it because it was content. We all have that content that we just feel like, listen, we have to grab the content. Now, when you post it, how you post it, who you post it to is a different conversation. But whether you saying that somebody will not record you, it's a very, very difficult thing to assume.
Whether you like it or not, you have done something wrong to him. You've taken a vulnerable situation. I've recorded without his consent. Thank God he's your husband. You sort it out. But also, you are respecting him still. By not releasing that content. Do you see that you love this person, you respect this person, that this is content that would have been fantastic for you, you know how the viewership, and yet you're holding on to it because you still need his permission to show this. So that's what we're asking people. Just show respect. There's no big deal. It's just show respect. Let's understand what this respect is for the other person. This world is not all about you. It's not all about your content. It's not about all about viewership. There are also other human beings that live in this world with you. And if people were to do to you what you do to them, how many of us would be left in this world? You know, we'll be so angry with each other. We're just asking young people to learn respect. We understand that you'll be making mistakes, but please learn from your mistakes so that the next generation will not even do worse.
I like the part Ramatu came in concerning the Mobad. You saw a lot of gory photos.
Don't forget it.
We got a lot of pictures. I mean, thank God I didn't see many.
I didn't see those.
Intentional not to watch her. So I didn't even see this one you're talking
Now
about.
that you have described it, now in my head.
But the point is that time, I remember people talking about these pictures. Who are those people? They were actually taking those photos.
They are going
so
fast.
it's a context in which people feel the need to have evidence of how this person passed on.
So we have to
I was buried. Yeah.
Junior Pope passed.
Yes.
Not only the people who were supposed to help him to the hospital make videos of him, I saw all of them. I could not help
everything.
I saw everything.
With cotton wool in his nose.
So one actor, or would we rather
I'm very not thankful.
No, I don't want to see
So there was a picture of him when he was confirmed dead. One actor said he had to post it because all of us want to know. Whereas we would have been fine in 2 days when we know he passed. Because now his family members have their loved one, and you know social media doesn't forget. Recently one gospel artist died, and videos are just jumping to my face. I was like, which day will I want to learn this thing? You know, because you don't have the consent of the late person, of the dead person, to invade their privacy in such a manner. And I wish their family would take it.
They're helpless.
They're helpless, and you are no now, and you're going to clout on it. People are going to rush to you for source.
That's why you're doing it.
They're doing it for you.
For yourself.
And it's, you know, the court should even, not ordinary, that's what they would do. All profit you made should be withdrawn.
Also those that go for maybe waykeeping.
And they are
taking their waykeeping, or they went there for 7. They want to be there with the dead body. They are walking past, lying in state. That's what
you are arriving at the door.
I meant lying in state.
With your life, you're already live.
Yes, lying in state.
There was one popular influencer that I followed because of it. She was arriving with life, and then she went to the cops.
Are you serious?
Yeah. As in, do you stage crying? Do you stage it? So because as you're crying, you remember your camera on point. You see, even the thing before you shake and you balance them, then you went there. Please, how wicked and selfish can we be? It's a selfish word, yes, but that's the height of selfishness.
I've even seen a picture where there was one that was doing makeup on the cops. She put her camera by the side and was doing
that was her mom. That was her mom. That was her mom. No. She said, I saw that video. She said she wanted her mom to enter heaven slaying. And so she put her camera by her side.
Everything.
That's her mom. And that's her mom. So that she get the body anyway.
Anyway, we have to go. Let's just take a few comments and then we wrap up.
Already?
Really?
Deborah says, I think many people are distracted with content making so as to make money. If due money is given to each profession and accountability is required, I think people will sit well and learn what and how.
And when people choose to sue, people ask, why are you suing now? You have to sue to teach some people lessons. But I think really, as I said, I just hope that we can learn to be more respectful, be emotionally intelligent, and be more sensitive to people's private content.
You got that.
That's all we can take on today's show. Hope you learned a few things that we have. See you tomorrow. Bye for now.